Hey guys, Coach Robbie here, and I'm with Dr. Serrano. Myself and Serrano are going to go through kind of a rapid fire Q&A. I've got 10 questions here, and I'm going to try and cover them all in 5 to 10 minutes.
So before he does that, I just got tortured. Tortured even to the point that my wife came downstairs and said, "What's going on?" He made me cry, laugh, I was in pain.
So we were trying a new treatment technique, which we might cover in another video.
Okay?
But the first question today is, what is aromatase and what factors influence the increase or decrease of its functions?
Well, people need to understand what aromatase is. Aromatase is actually an enzyme or a protein that takes something and makes it go to something else. So for example, aromatase is going to take testosterone and it's going to make it go into estrogen. So that's what basically aromatase is. It's an enzyme that takes testosterone and changes to estrogen. Now, what things influence aromatase? Inflammation is number one, obesity is number two. Actually, diabetes will influence aromatase. Drugs influence aromatase. And the number 1 and 2 most popular drugs that affect aromatase are actually alcohol and marijuana. So people that drink a lot, people that smoke pot, or even use it recreational have an increase in aromatase. Now that also later, the drinking and the smoking are the number 1 and number 2 reason for what they call gynecomastia, because they increase. Now there has to be also inflammation. Most people that smoke pot are either very, very skinny or fat, because they have inflammation, they don't do anything, they don't eat well. So that's what aromatase is.
And to my knowledge, there's one place that aromatase is produced, and that is adipose tissue. Are any other cells in the body that produce aromatase enzyme?
No, actually aromatase is also, there's some in your testicles, there's some in your glands. So there's other parts that have it. Now, there's more in that fat tissue, absolutely.
So is aromatase bad?
No, absolutely not. You need it. Actually, there are people that have genetic defects in which they don't have aromatase, and they develop cardiovascular disease.
Exactly. So the poison is in the dose, because with the testosterone that you do produce naturally, you do aromatize some of the testosterone to estrogen, because estrogen is essential in the body in the right amounts.
Absolutely. Actually, testosterone is, I know what I always tell you, it's a pro-drug, it's a pro-hormone.
Yeah.
Testosterone has to either be converted to estrogen, has to be converted to DHEA, or to the breakdown products. So testosterone is a highly anabolic drug, but it has other secondary effects. Now, the other secondary effects have to come through the secondary changes that it does.
Gotcha.
Now, one is aromatase, the other one is 5-alpha reductase.
Okay. Perfect. So we covered it quite a bit there. Second question that was sent in was, do you have any recommendations for dealing with an individual with gestational diabetes?
Actually, gestational diabetes, I did obstetrics for 9 years. And in those 9 years, I had 8 people with gestational diabetes. And that's because they did not follow my rules. Anybody that is pregnant, that has high blood pressure, proteinuria, or protein in the urine, they have issue with their platelets, or they have any issue with their pregnancy, they should be in an absolutely extreme low carbohydrate diet. And that I do know the numbers. The research says 40 grams. And actually, I can tell you, I delivered thousands of babies. And I'm talking about thousands. In 1 month, I delivered 72 babies. That was 2 or 3 every night. And I'm telling you, people that were my patients, my own personal patients, they did very well. People that were not my personal patient that I was covering for somebody else, they have preeclampsia, they have high blood pressure. Those people were eating a very high carbohydrate diet. Once you cut those carbohydrates to 40 grams, absolutely, you make a major difference on those people with gestational diabetes.
So do you think it's good to check your fasting blood sugar and your postprandial blood sugar?
Absolutely. If you have a finger stick machine,
even without gestational diabetes.
Absolutely. Do a fasting, eat, and then an hour later check it. Now I want to say this: don't go if you eat ice cream and you eat, another carbohydrate. It's going to make a difference that hour.
So it's a simple thing there as well. When you combine sugars with fats, you not only increase the blood sugar secretion, but you extend it for a longer period of time. So you just need to be aware of that.
Yes.
Question 3, what are the main differences between Crohn's and ulcerative colitis?
Okay.
And what influences your types of treatment for both?
Okay, actually, Crohn's and ulcerative colitis is a name given by physicians to distinguish how the lesions or I'm going to call it ulcerations or inflammation happens in your gut. One has what is called skip lesions, meaning this is good tissue, this is bad tissue, this is good tissue.
Skip lesions.
Skip lesions, okay, and that can happen through the whole colon, intestine, whatever. Ulcerative colitis happens more on the colon. That's what it's called ulcerative colitis. One is related more to Jewish people, and that is Crohn's, okay? And also one is related to more what they call peripheral tissue. You can have rashes, you can have inflammation of your joints, ulcerative colitis. One can be more colon, like I said, ulcerative colitis. One can also be more tendency to have cancer, colon cancer, okay? But I don't think for the patient matters because is it almost the same treatment, okay?
Yeah.
But it depends on the allergies and other factors, but the treatment is basically the same. So once you hear you have ulcerative colitis or Crohn's colitis or Crohn's, you don't worry about, oh my God, I have either one of those. You have to fix it now.
And the symptoms are very, very similar for both. So.
Oh, absolutely. The same, actually. They're the same symptoms.
Yeah.
The only time it's differentiated when you get Crohn. Then we can say, oh, it's ulcerative colitis versus Crohn's disease. But the treatment, if you go to a specialist, it's going to be the same.
Yeah.
Remicade or anti-inflammatory or whatever, or surgery if it's severe.
So nutrition recommendations, you would look at, okay, food allergies.
You have, every patient with colitis must have a food allergy. If you don't have access to that, then you need to do an elimination diet.
And the 4R protocol, so I'm pretty sure there's a video on YouTube with John Meadows and yourself, Serrano, talking about the 4R protocol, so I recommend checking that out as well.
Yes, absolutely. And you know, elimination diet, you sit down and say, which foods do I eat every day? Write them down. Once you write it down, okay, when do I have pain? Start taking pictures of your diet. Okay, an hour later after I ate this, I have pain. Then you need to start eliminating those foods that are on that picture, and you're going to see a major difference, even before seeing the doctor.
And I would chime in and say, well, the 4R protocol is remove, replace, repair, and re-inoculate. But if you don't remove the foods, it's like if I kick Serrano on the shins over and over again, and he puts on a shin pad, we haven't taken away the stress. So we got to remove before we go to repair, replace, or re-inoculate. So, and that's what most people do wrong. They don't remove for a long enough period of time, or don't remove all the food allergies or food triggers. So if you just remove one, you're not going to see a problem.
No, you have some foods cross-react.
Yeah.
Meaning I can have a reaction to, I don't want to make
it's
samples.
called molecular mimicry, right?
Yes, mimicry, that is the word. I can have a wheat reaction, but it's close enough to oats. So yeah, I'm eating gluten-free, supposedly by the way, but I'm eating oats, I'm going to react. So you have to be aware of that. Peanuts are beans, so if you eat a peanut and then you eat red kidney beans, if you eat chili, I'm not eating peanut butter, but I'm eating kidney beans with my chili, you might cross-react. You need to be aware of that situation.
Agreed. Next question is, what are the benefits of oral DHEA? And from spending a lot of time with Dr. Serrano, I've seen him recommend DHEA for women, men, all ages, and there's a vast array of kind of benefits to DHEA. Well, can you cover a couple of recommendations?
You know what? First of all, when people go buy DHEA, they go buy it on the supermarket. Or
yeah,
the
you can get it anywhere. You can get it in Target, Walmart.
That's the problem with that though, because we did, I can't remember the number, but we did some testing on DHEA. And actually, that and melatonin. I know melatonin, in 17 different melatonins, only 2 have what they say they have. Or they have something else, or they didn't have any, or they have very high dosages. DHEA is very similar. But the problem with DHEA, I only use companies that I know that really have DHEA in there, number one. Number 2, dosages. People use 25, 50. Yeah. In the literature though, the highest dose documented in the literature, I'm sure there's people out there that are taking more, 1600 milligrams, 1600 milligrams in the literature. Okay, that was done to older people for a period of time. Actually, it was 28 weeks or 34 weeks. And those people got benefits. Now, when
men or women?
They were men and women, both.
Both, okay. So just to make it clear, guys, the recommendations I've seen typically are 10 milligrams for women, maybe 25 to 50 for guys. So you said 1600. 1600.
I do not recommend that. This was done on a research base. And people were saying, you know what? They did get a lean body mass. They also felt better emotionally, physically. It was a, how would I call it? The unknown, the dark force. Hey, I don't feel anything outside, but I feel better. I'm more positive. I can get up. Little things that were not there before. Yeah. Now, DHEA now is considered neurotransmitter. It actually works on the brain. Actually, it's neurogenic, and I have been telling Roy for a long time, lithium is a neurogenic agent for sure. Now we're finding out that actually DHEA, it might be not neurogenic, forming new nerve, but it protects against nerve deterioration. For example, when your cortisol level, you're highly stressed, and you start forgetting things, you start having things on your mind. Well, DHEA protect against those issues. Now, I do not do super high dosages in my office like most people do. A woman usually start at 5 or 10. Men 25 and 50.
So you say you don't use high dosages, and is that because it has the potential to aromatize, or is there other factors there?
And
I do know that another name for DHEA is the warehouse hormone, because it can be a precursor to other hormones.
And that is a great question. In men, it tends to go into estrogen more because we have higher levels of testosterone. So it doesn't want to go to what it already has. But if you have low testosterone, it will be converted to testosterone. Now, DHEA also doesn't like to go to estrogen by itself because you have to go through two steps to do that. So the body never wants to spend energy, but if it requires, it will do it. Now in DHEA in women goes to go to testosterone because it's easier to do it.
Yeah.
There's a lot of estrogen that goes to testosterone. In men, they tend to go to estrogen. Now, but if you have a guy that have low testosterone from the beginning and you put on DHEA, that guy might get a higher level of testosterone. Actually, DHEA, and I have been being tempted by Robbie here. He knows my blood test, right? And he kept saying, you need to take testosterone, right? Your testosterone is low.
And if you look at the research on testosterone, it has a lot of therapeutic
value. I understand. I take DHEA. I don't feel bad. You know, I tell Robbie, I feel great. Man, I have a great life. Of course, I'm still strong. I don't want to be stronger from the boys in Ireland. You know, if I start taking testosterone and go there, I'm going to whip everybody. I don't want to do that yet. Not yet. I still whip Adam Ward, but I don't want to do that yet. So yes, I should take testosterone, but I'm happy. I feel good. And people will ask me why I don't do it. When you take testosterone, there's always affects your brain. I want to tell people, induces more sexual thoughts because it's a horny hormone. Okay, and I'm always concerned that hey, I'm gonna go do things that I shouldn't do. That's my only fear. But physiologically, absolutely, testosterone helps with joints, energy, stamina, depression. It's incredible.
Bone density, cardiovascular health.
Oh,
the list goes on. So you mentioned one thing there about DHEA, and you said it has the potential to aromatize.
Yes.
To estrogen. Now, people are, on the internet can be pretty afraid of estrogen. Is the aromatization necessarily a bad thing?
No, but if you're smoking pot or drinking alcohol and you take DHEA, yes, it will convert to much more estrogen.
Too much?
Yes, you can do that.
Just wanted to clear that up. So next, what should you look for when reading a probiotic supplement?
Okay, this is why I argue with Robbie sometimes. Like now, Robbie Saccharomyces boulardii, that's something you know now. But in my practice,
there's so many strains of bacteria, there's so many dosages, there's other ingredients like prebiotic fibers thrown in and different forms of sugars. So
I love probiotics, but I'm not gonna be the guy that you take probiotics. First of all, do you know how companies decide? Truly, company decides, can I keep this probiotic alive? If I put on a tablet or capsule, can it stay alive? So they do that. The extension of the life of the probiotic. To sturdiness, if I put on the acid, will it go through it? People have no idea that those are two of the main requirements. Now, also they assign a number to that probiotic. That's how they separate it, that's how they grow it, all these things. Now, there are probiotics that affect specific conditions, and there are research into that. The lactobacillus rhamsus, lactobacillus, there are different ones for asthma, for eczema. Yes, they are there. But again, if you have those symptoms and you don't eliminate the food, you're not doing that. You're not doing anything. Now, if you have probiotics to a person that have issues already, is it the bacteria that is causing it, or is it the food? You don't know. So I'm always very slow on doing probiotics.
And it's multifactorial. So just from spending a lot of time with Eric, really, when we look at probiotics and prebiotics, stuff like that, we know sweet feck all about that subject. And I think, in my opinion, I think it's better to treat the symptoms than to test using stool analysis and stuff like that, because really, a stool analysis might say one thing, and then the symptoms of the individual might say another thing. So symptoms and how the patient feels is much, much better to go on than looking at a stool test.
Absolutely, and the test that we check is something called RS16, ribosome 16. I want you guys to learn this, people don't know this. If I poop, by the way, probiotics only tell you, a stool test only tells you the last portion of the colon. The last. Yeah. It doesn't tell you intestine, it doesn't tell you middle intestine, it doesn't even tell you the upper colon. It just tells you the lower portion. Now, that can give you some ideas, but it's RS16. We are not culturing, we're not isolating bacteria, we use based on the ribosomal RNA. Now, I want to tell you this, most people say bacteria is the most abundant. The most abundant thing in your gut is viruses, FAGs, PHAGE. Those communicate with bacteria, they kill bacteria, they can make bacteria grow faster because they exchange DNA. So be aware that one company, and Robbie doesn't know this because I didn't want to tell him this, there's one company that has viruses for supplemental, for probiotics, yes.
It's crazy. And the thing is with probiotics as well, people sometimes hand it out like it's candy, and they don't understand the strains, they don't understand the impact it will have on the individual's microbiome. So you got to be careful with that because they don't replace a shitty diet, you know. So
absolutely, spores, exercise, stress, anything that you cold weather, anything that you do outside changes your bacteria.
So how fast can your microbiome change? Like I've been over here 7 days right now.
Yes.
Do you think my microbiome's changed?
Absolutely. Especially Robbie he eats in Ireland. Now he eats like a bastard here, like a freaking pig. I mean, he sits there, eats and eats and eats. And yesterday we have a special meal that is called platanon. It's kind of like a fried green banana or sweet banana that tastes really good with beef on it and sauce and onions and all this stuff. And you know, that is a whole different, it's a prebiotic for the bacteria. And it's something different that he doesn't have. That's going to affect his microbiome.
Okay. So, this was meant to be a quick fire Q&A, but we went way over a couple of questions, but you know, that's even better because we've got tons more information. So next week we're going to do another one. We're going to try and answer about 5 to 10 questions, but do send in your questions and we'll try and get around to them all. Thanks for your time.
Thank you.